Hello and welcome to your lecture. In this recording, we're going to continue our series on muscle identification. This should be part 4. We're going to go into the muscles of the arm. Recall that there are about 700 muscles in the body. We're only taking a survey of about 50 of them. Through this recording, I will mention or point out the muscles that you will need to know for the origin, insertion, and action quiz, which is in addition to your muscle online practical. So let's walk through. And again, all of these pictures, for the most part, are in your lab manual. They should be posted on your class homepage as well. Okay, when we're looking at the arm, let's start with the biceps brachii. The biceps brachii muscle is a flexor muscle on the upper part of our arm. We're all very familiar with this one. This again is a muscle that will be pronounced in bodybuilders. Usually they work really hard through particular activities to exercise this muscle. Now it's called the biceps brachii because there will be 2 heads to it. The biceps brachii muscle has the action of flexing the forearm. It's able to do that because it originates on the coracoid process of the scapula and the superior lip of the glenoid fossa. It will insert on the radial tuberosity. So it's going to cross the elbow joint. And because it crosses that joint, we can understand that insertion point. Next muscle is the brachialis muscle. The brachialis muscle is right here. It's next to or surrounds the biceps brachii. You could say surrounds. When you're looking at it anteriorly, you'll see it here. So the brachialis muscle also flexes the forearm at the elbow joint. It's able to do that because it originates on the distal anterior surface of the humerus and inserts on the proximal ulna. So this guy will insert on the pinky side, whereas the biceps brachii inserts on the radius. Hopefully that makes sense. As we're trying to move that forearm, we have 2 helpers to move the 2 bones of the forearm. Also, I want to give you a general rule. This might not be 100% blanket statement, but for the most part, your flexor muscles will be on the anterior portion, specifically when we're talking arm anyway. This gets a little different. Maybe when we hit like the lower extremities, there might be some variations there. Your extensor muscle groups are on the posterior aspect of the arm. The next muscle we have to look at is the triceps brachii. We can see a little bit of it here on this picture. If we look at the posterior aspect of the arm, we get to see it a lot better because it's revealed more clearly. You will have to know the triceps brachii origin and insertion for your quiz on origins and insertions. The triceps brachii, hopefully the word triceps gives you the indicator that there are 3 heads to this muscle or 3 origin points. It extends the forearm. Because it extends the forearm, it's an antagonistic muscle to the biceps brachii, which flexes the forearm. It can extend the forearm because it will originate on the shoulder girdle and the proximal humerus and then insert on the olecranon process of the ulna. Remember that olecranon process, that's your elbow, the bony part that we feel. You can see really nicely here as well the 3 heads of the triceps muscle. You can see, well, you can see 2 of the heads and 1 you have to dig a little bit for. You have a lateral head, which will be on the lateral portion of the arm. Hopefully that makes sense. The longer head will be more medial, and then you will have a medial head. The brachioradialis, look at the word. It's going to have something to do with the brachial region and your radius. So the brachioradialis is on the flexor, the lateral portion of your forearm on the flexor side. The brachioradialis flexes the forearm. It can do this because it originates on the lateral supracondylar ridge of the humerus and will insert on the base of the stylus process of the radius. So it's going to extend the whole way into that wrist. Remember that styloid process of the radius is near the thumb. Next, we have the palmaris longus. Let's see if I can get a better view of it. I think we'll stick with that first picture. The palmaris longus, by the words, has something to do with the palm of your hand, and it will be long. Hopefully those words will make sense. It's sort of this central band of muscles that runs through the flexor surface of the forearm and has something to do or will attach to the palm. The palmaris longus has the job of tensing the skin and the fascia of the palm during a lot of hand movements. It can do this because it originates on the medial epicondyle of the humerus. So it's going to run along that medial side and then will insert on the fascia of the palm of the hand. Therefore, it's able to move the fascia. So it's a connective tissue mover. Pretty neat muscle. So the pronator teres muscle, it's this small muscle that has the job of pronating the forearm. It's able to pronate the forearm because it originates on the medial epicondyle of the humerus and the coronoid process of the ulna, and it will insert on the mid shaft of the radius on the lateral surface. So lateral, if you can follow this muscle, it's not easy to see on this picture. I don't really have a great one for it. Again, originates on the medial epicondyle of the humerus and the coronoid process of the ulna, and it stretches its way down to the lateral side, which would actually be like the outside of the radius towards the wrist. The next muscle on our list is a flexor carpi radialis. We can see it on this muscle pretty well. It's a flexor muscle. Therefore, it has the job of flexing, but what it's going to flex is the wrist and will abduct the hand. By the words, hopefully you can determine what it's trying to do. Again, it's a flexor muscle. It's a carpi radialis. So it's going to do something or move the wrist by way of how it attaches. And it's a radialis because of it's going to be able to do this on the radial side of the hand. It originates on the medial epicondyle of the humerus and will insert on the second and third metacarpals. So it's going to insert on the hand, but it swings. You can see how the flexor carpi radialis goes from the medial side to a more lateral side. Next muscle is the extensor carpi radialis longus. So we're going to have to flip sides because we're looking at the side of the hand that's going to have mostly flexor muscles. Let's find the side that has the extensor group. Okay, we have the extensor carpi radialis longus on this muscle here. This muscle will be on your origin and insertion quiz. It has the action of extending and abducting the wrist and can do so because it originates on the lateral supracondylar ridge of the humerus and will insert at the base of the second metacarpal. You can see where this guy is right here. It's a thin band that will be on the the lateral supracondylar ridge of the humerus, so lateral side, and the base of the second metacarpal is where it will insert. Next, we have the flexor carpi ulnaris muscle. We can see it on this side of the picture. And as you're noticing, some muscles can be seen from both the anterior and posterior aspect. It depends on their location. This is a pretty thick muscle in your forearm. It has the job of flexing the wrist and abducting the hand. And it can do this because it originates on the medial epicondyle of the humerus and will insert on the carpals of the wrist and fifth metacarpal. So this guy will originate on the medial aspect and insert near the pinky. The extensor carpi ulnaris. Oh, if I didn't mention, the flexor carpi ulnaris is another one you'll need to know for origin and insertion quiz. The extensor carpi ulnaris. It's an extensor muscle that extends and adducts the wrist. It originates on the distal humerus and posterior ulna and inserts at the base of the fifth metacarpal. The extensor digitorum muscle, this one right here. It kind of runs pretty central on the extensor surface, which is the posterior surface. It has the role of extending the fingers and the wrist. It originates on the distal humerus and inserts on the distal phalanges 2 through 5. Okay, that is all we need to know for this section. Stay tuned for the next one.